Group 13, Introduction to Medical, Health and Pharmaceutical Industry. In this presentation we will be discussing the characteristics of the pharmaceutical and health industry, the recent development of the industry, the importance of this industry in Ireland, the comparison between Ireland and other countries, key regulatory institutions and their role, as well as key stakeholders and their roles. The characteristics of the pharmaceutical industry. The pharmaceutical, health and medical industry is one which is highly profitable. The sector contributes more than £1 billion in corporation tax to Irish exchequer annually. The sector was valued at £50.8 billion in 2010, a 7.3% increase from £47.3 billion in 2009. The worldwide industry has invested over £7 billion into the country in the last 10 years. The pharmaceutical industry is relatively new to the Irish economy. It provides a vast amount of jobs with 50,000 people employed both directly and indirectly. Recent developments in the pharmaceutical industry. To constant flow of findings and research, the industry has gone to become one of the largest in the world, with Ireland playing a particularly large role. According to a report by the IDA, Ireland was the largest exporter of medicine and pharmaceutical products in 2014. The industry has also seen a surge in the release of generic brands in recent times. This is due to the end of patents, as most only last 12 years. For example, Pfizer has released a generic pharmaceutical tablet which is cheaper than the leading brand, Panadol.
9 out of the 10 largest pharmaceutical companies in the world and 120 overseas companies have plants in Ireland. The Irish government has also invested €8 billion to research funding in the pharmaceutical sector in order to boost Ireland's reputation as a hub within the global pharmaceutical industry. In 2013, pharmaceutical exports from Ireland accounted for nearly €39 billion. Ireland is the 7th largest exporter of medicinal and pharmaceutical products in the world. Pfizer is an American global pharmaceutical company that was founded in 1849. It was one of the first pharmaceutical companies to set up in Ireland. Pfizer then went on to set up 6 more operations in Ireland, investing around $7 billion in all of them over the space of 45 years. Today, Pfizer is a huge employer in Ireland and provides jobs for over 4,000 people. Its activities in Ireland also support around 10,700 other indirect jobs, resulting in a €2.2 billion output to the Irish economy. GlaxoSmithKline is also one of the world's largest pharmaceutical companies. It is a British company. GlaxoSmithKline first set up in Ireland in 1975 in County Cork. Since then, it has set up operations in 3 other locations, Waterford, Sligo and Dublin, providing employment for 1,500 people in Ireland. It is currently in the process of investing €250 million into its production site in Cork. The comparison between Ireland and other countries. Self-reported good health in Ireland is at an all-time high at 83.4%, making it the healthiest population in Europe, with the OECD average at 69%. Self-reported good health of over 65s is at 63.9%, a lot higher than the OECD average of 42.7%. Making it the 3rd healthiest country in Europe, only behind Switzerland and Sweden. Adult obesity in Ireland is now at 23%, much higher than the OECD average at 17.6%. 19% of the adult population smoke in Ireland, making it the 4th worst of all in Europe. Ireland is the largest exporters of pharmaceuticals in the EU, accounting for over 50% of all exports from the country.
Key regulatory institutions and their role. There are many regulatory institutions in the medical industries of Ireland, however there are 2 that stand out in particular: the Medical Council of Ireland and the Health Products Regulatory Authority, formerly known as the Irish Medicines Board. The 2 main differences between the 2 are that the Medical Council is a private body and the HPRA is a public body. The Medical Council of Ireland. This council regulates the medical profession in Ireland. The HPRA role is to protect and enhance public and animal health through the regulation of human and veterinary medical products. Key stakeholders and their roles. The main company controls the financial budget. They come up with a strategy for growth. They're responsible for working within regulations and the law. Key opinion leaders influence the investments of the company. They are responsible for the research on illness and the promotion of drugs. Marketing is responsible for generating sales. They try to achieve this by broadening public image and promotion. From our research, we have found that the industry is highly profitable. As we discussed at the beginning of our presentation, it brings millions into Ireland alone. It is highly regulated, for example, the Medical Council of Ireland and the HPRA. It is highly influenced by the social demographic. For example, the elderly require large quantities of various drugs, and it provides many jobs both in Ireland and across the globe.